So this is video submission for week 4. What is gadolinium? So it's gadolinium is injected into the veins to basically enhance the appearance of pathologies, basically bettering the our MR images. And gadolinium can have potential complications like impaired kidney function, severe allergies, and complications with IV. But we can minimize these complications. Example, for allergic reaction, we can give them Benadryl. When they get reactions, we can administer oxygen, IV fluids, or epinephrine, or we can actually give them pre-medications before administering the gadolinium. For IV complications, we can avoid, it can be avoided by making sure we administer and insert the IV right. We have to make sure there's no leaks, and the needle and cannula should never be placed in the artery. IV supplies also should it should be sterile and fresh from the packs. Make sure we use gloves while doing the IV to avoid contamination. For kidney function, we can check the patient's GFR on the day of the exam. We can use an iStat machine, not entirely sure what it's for, and we can consult with the radiologist. If the patient refused the contrast, we have to make sure we make a documentation about it. We have to make a report that they refused the contrast, but we gotta do the scan anyway without the gadolinium. And then if needed, they would have to come back for a follow-up exam. For number 2, 3 main scan planes. So for the scan planes, we have coronal, sagittal, and axial. Coronal divides the body into sections from anterior to posterior, meaning front to back. Sagittal, we have left to right or side to side. Axial, top to bottom or superior to inferior. See here, why is it important to take notes at clinicals? So I guess it's important to take notes for clinicals because we're basically students, so that's what we have to do, like in actual classes or in live sessions. We have to take notes to remember the stuff that is being taught to us. We have to take notes and write down each and everything that we do in the clinicals, because not everything will be absorbed or retained in our brains. Also, different sites have different protocols, or radiologists may have specific ways on how they do scan sequences. See if I taking notes. Number 3, extend your understanding of a protocol in MRI. What are they and why are they used? Protocols is basically the sites guidelines on how they do certain things. Like we can think of the protocols as like shopping lists that we have to complete before we could send home the patient. Like for the brain, we have several different types of protocols for the brain, different routine and screening, seizure or epilepsy. It just means not all brain scans are the same, basically. That's it.